Hello, this is Miseon Shim from Tech University of Korea. I have researched biomedical engineering and neural engineering based on artificial intelligence AI techniques. In particular, I have been investigating the distinct brain function in psychiatric disorders, for example, schizophrenia, depression, anxiety, and obsession patients using physiological electric signals. I usually investigated the brain function using electroencephalography, so-called EEG. And also, I have been developing the diagnosis and prediction systems using neurophysiological biomarkers based on artificial intelligence techniques. So today I'm going to talk about and introduce my research. The title is Development of Artificial Intelligence-Based Digital Healthcare System for Psychiatric Disorder. Traditionally, the diagnosis of psychiatric disorders is conducted through individual interviews with the clinical experts. During the interview, patient symptoms are scored using specific assessment tools such as PANSS score for schizophrenia patients and PDI score for depression patients. However, since traditional diagnostic methods rely on the personal interviews, so the accuracy of the diagnosis can be compromised if patients attempt to cheat their symptoms or if subjective judgment from clinicians influence the assessment. So, objective diagnosis tool for diagnosing psychiatric disorders should be developed. Then, what tools can be used for an objective diagnosis of psychiatric disorders? In general, patients with psychiatric disorder tend to show the functional problem in the brain rather than structural problem. So, tools that allow us to estimate these functional characteristics of the brain are necessary. Among various neuroimaging tools, electroencephalography, so-called EEG, is most stable tool to investigate functional characteristics of brain due to its high temporal resolution. The human brain contains cells called neurons. When processing internal or external information, neurons transmit signals and process information through neurotransmitters. These neurotransmitters convey signals in the form of electrical signals, and this electrical activity or the method of measuring it is known as an EEG. To observe the functional characteristic of the brain, EEG is measured and analyzed. Most of all, I have been investigating the distinct brain activity of psychiatric disorders using neurophysiological biomarkers, which can be a base for diagnosis and prediction systems. Firstly, event-related potential, so-called ERP, is a brain response to specific events or stimuli, such as cognitive, sensory, and motor events. ERP characteristics were estimated by shape of ERP wave, like amplitude and latency. As you can see the left figure on the top, psychiatric disorders show different ERP characteristics when compared to that of healthy people, such as reduced ERP amplitude and prolonged latency. Such as distinct ERP characteristics reflect the altered brain function, such as reduced cognitive function and broken processing of facial information. Also, I employed the source imaging study using EEG data recorded in scalp. Through the source imaging study, brain activity can be investigated in the cortex level non-invasively. The figure on the right side on the top, I found that source activity in schizophrenia patients are lower than healthy people when processing cognitive function. And reduced source activity in schizophrenia are related to altered cognitive function. Also, when processing information, various brain regions interacted with each other, and I discovered this result using the functional connectivity method. EEG is suitable for investigating the functional connectivity because the temporal resolution is higher in EEG than the other neuroimaging tools. So I investigated functional connectivity in schizophrenia when they processing various visual stimuli. So there were differences according to the time between schizophrenia patients and health controls. This result could mean that altered connectivity in schizophrenia is related to their psychiatric symptoms. And then functional connectivity could be quantified as network characteristics using graph theory. I investigated brain networks in the schizophrenia, post-traumatic stress disorder, and depression patients, and they each show distinct network characteristics. Interestingly, broken network characteristics were significantly correlated to patient symptoms. Furthermore, instead of merely identifying these biomarkers, I conducted research aimed at improving the quality of life for patients with psychiatric disorders using these biomarkers. To achieve this, I utilized artificial intelligence AI techniques. In particular, I aimed to develop the computer-aided diagnosis CAD systems that combine EEG data or biomarkers with AI algorithms for patients with psychiatric disorders. So, in this presentation, I'm going to talk about my research on AI-based computer-aided diagnosis CAD system for psychiatric disorder to assist of diagnosis of disease and prediction of symptoms. So I think in this presentation can be divided into two main parts based on artificial intelligence technique. So in the first part, I will discuss CAD system for psychiatric disorders developed using machine learning algorithm. And then in the second part, I will cover the development of deep learning-based CAD system for psychiatric disorders, which can be increasingly developed recently. So in particular, this presentation will focus on the patients with major depressive disorder, so-called MDD, among various psychiatric disorders. MDD patients characterized by at least 2 weeks of pervasive low mood. MDD is also characterized by symptoms such as loss of energy, difficulty concentrating, and suicidal thoughts. In severe case, symptoms can include delusions and hallucinations like psychotic symptoms. In South Korea, the lifetime prevalence of MDD is relatively high at 5%, and then women show the prevalence rate twice as high as men. Early diagnosis of MDD is particularly important because the recovery rate is significantly higher at 54% when diagnosis and treated early. However, if treatment is delayed, the recovery rate drops to 16%, which is approximately 3 times lower, underscoring the critical need for timely diagnosis intervention. So, therefore, I conducted research to develop an resting state ease-based CAD system for MDD patients aimed at aiding the early diagnosis and treatment of patients with MDD. As the first part of this presentation, I would like to talk about machine learning-based computer-aided diagnosis CAD systems with resting state ease data for diagnosing MDD patients. The aim of this study was to develop a practically useful resting state ease-based CAD system for timely diagnosis of MDD patients, and this study published in Journal of Affective Disorder in 2023. To this end, eyes closed and resting state ease data were recorded from 49 MDD patients and 49 health controls. Then we pre-processed ease data to remove the artifacts, and we computed source signal via computing inverse problem. And we use both sensor level ease signals and source signals to extract features which are referred to as sensor level and source level features respectively. Using both level signals, 6 different ease feature sets were extracted. Power spectrum density PSD, phase locking value PLVs, and network indices based on graph theory for both sensor and source level. Then on the study A, we differentiate MDD patients and health controls using a linear support vector machine SVM classifier with ribbon-out cross-validation. Also, on the study B, we investigated the change in classification performance according to the reduction of feature numbers by stepwise reduction of ease channels to develop a clinically practical resting state ease-based CAD system. As a result, a maximum classification accuracy of 81.63% was achieved when using the 5 sensor level PLV features, and its sensitivity and specificity were 79.59% and 83.67% respectively. The highest AUC value of 0.94 was achieved when using the sensor level PLV features, which is in agreement with the classification accuracy result. Then, to reduce the number of used channels, we used 4 different types of ease channel montages, which are depicted on the right side. 4 different ease montages have 62, 30, 19, and 10 channels based on the international 1020 system were used. The classification performance was maintained even though there was a significant reduction in the number of ease channels from 60 to 19, but a relatively lower classification performance was achieved when using 10-channel montage. And the highest classification accuracy of 83.67 is achieved when using 90 channels. In this study, we demonstrate the promising potential of sensor-level PLVs as diagnostic features when developing a resting state EEG-based CAD system for the diagnosis of MDD patients and verify the feasibility of the practical use of the developed resting state EEG-based CAD system using the channel reduction approach. As the second part of this presentation, I would like to talk about deep learning-based computer-aided diagnosis systems with EEG data for MDD patients. To utilize machine learning algorithms to develop the CAD systems, handcrafted features should be quantified before. But when features are extracted manually, the system's efficiency may decrease. And the performance of the CAD system can be affected by human error when developing the features. So, to address these limitations of machine learning-based CAD systems, research on deep learning-based CAD system for psychiatric disorders which can diagnose without feature extraction is actively being conducted. So, I will now discuss the development of a deep learning-based MDD CAD system using EEG signals. In this study, resting state EEG data were collected from 41 MDD patients and 41 health controls for analysis. As previously explained, deep learning does not require separate feature extraction steps. So we use the artifact-free EEG data, which were pre-processed were directly used as input data for deep learning architecture. Among various deep learning models, a convolutional neural network CNN model was employed in the present study. In particular, a shallow component model was used in this study, which is known as stable CNN model to EEG data. This model has a simple structure composed of layers based on spatial and temporal filters. The model's performance was evaluated using ribbon-out cross-validation. In addition, to improve the efficiency of the deep learning-based CAD system and enhance its practical feasibility, we reduce the used channels based on channel selection approach. To this end, the layer-wise relevance propagation LRP algorithm, which is an explainable AI approach, was used to extract relevance scores of deep learning model. Then statistical methods were applied to the relevance scores, which extracted from the validation set to identify channels with significant difference between the two groups. And the diagnostic performance was evaluated using the selected channels based on LRP approach, and we reduced the number of channels from 62 to 1. By using relevance scores, we gradually reduced the number of channels from 62 down to 1 to evaluate the diagnostic performance at each step. The results show that the classification accuracy remained at 100% until the number of channels reduced to 25, and it was over 90% even with 5 channels. Then we investigated the channel locations of selected channels via XAI LRP algorithm. When the number of selected EEG channels was increased from 1 to 5, most selected channels were concentrated in the left parieto occipital area. As the number of selected channels increased, the focus was expanded sequentially to include channels in the right parietal occipital central and frontal area. This study successfully developed a high-performance and practical XAI-based CAD system for MDD patients. Our developed CAD system not only achieve high diagnostic accuracy but also provides meaningful neurophysiological biomarkers for MDD patients. In today's presentation, highlight two main points. First, we investigated how neurophysiological biomarkers can help us understand the pathophysiological trait in the psychiatric disorder, providing a more objective foundation for diagnosis. Second, we develop AI-based CAD systems, including machine learning and deep learning algorithms as tools to improve diagnostic accuracy and objectivity. These systems have promise in reducing human error and supporting early diagnosis, which is crucial for effective treatment. In summary, I researched to enhance the quality of life for patients by advancing diagnostic methods in psychiatric area. So we expect that the systems developed through our research could soon serve as AI-based digital doctors, which allow individuals to easily check their mental health status anytime and anywhere without limitation of location or time. So, thank you for your attention.